is a nutritional supplement leader. Our targeted formulas include MacuHealth for daily eye health, MacuHealth Plus for aging eye support, Vitreous Health for vitreous care, Vision Edge Pro for visual performance in athletes, TG Omega-3 for ocular and systemic wellness, and MacuHealth DM for eye and metabolic support. Call MacuHealth today and mention this podcast for special discounts. Experience the difference with MacuHealth. Nutrition you can see.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. Welcome back to part 2 of my conversation with Dr. Jim Stringham. In this episode, Dr. Stringham shares how macular carotenoids and omega-3 fatty acids may help reduce the risk of severe damage from traumatic brain injury. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell. Also, please leave comments. Be sure to watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube Movies and Shows. Dead center in the macula for the pigment is mesozeaxanthin, then zeaxanthin, then lutein. Before we get back to the brain, if you could tell what's the different function of each one of them, mesozeaxanthin, zeaxanthin, and lutein. We need all three of them, and we don't get meso typically isn't big in the diet. You know, we got to count on lutein to convert it, or we have to supplement because some people can't convert. So if you could talk about those three and specifically how they're different.
Yeah, that's right. That's right. So the spatial distribution of the density of macular pigment, right around the center of the fovea, the foveola, you've got this sort of typically a mountain peak, and right there in the center, you can imagine a column right in the center of the macular pigment density distribution. That would be mesozeaxanthin, and just down the hill a little ways from there is zeaxanthin. And then filling out the flanks is lutein. It's important to note that there's roughly a 1-to-1-to-1 ratio. So they're equally represented in the retina, despite the fact that lutein tends to be the dominant carotenoid of the three in the diet. So leafy greens, for instance, will have a 3 or 4, 5-to-1 ratio compared to zeaxanthin dietarily. And you're correct, mesozeaxanthin, it's in the human food chain. It is rare in the diet. However, there is an enzyme in the retinal pigmented epithelium, RPE65, that converts roughly half of lutein into mesozeaxanthin. Now, this is in the normal case. There are, if it looks like from the data, 15 to 20% of individuals that either have a compromised conversion enzyme, this RPE65 is compromised, or it's completely dysfunctional. And so what happens then? It means we don't get enough mesozeaxanthin into this distribution into the retina. And so what that manifests as when you look at the actual spatial distribution of macular pigment, normally a mountain peak, the peak turns into a dip. And in some cases, the dip goes very low. And these are presumably folks with that completely dysfunctional conversion of lutein into mesozeaxanthin. What you see correlating to this is family history, family risk, this hereditary risk of AMD. Completely separate studies have shown that folks with the family history of AMD are 47% likely to have this foveal macular pigment dip. So wild to think that, these genetics, along with, sort of the lack of protection afforded by macular pigment right in the center of the foveal macular pigment distribution, they are at risk. They're at great risk, both genetically and because of the lack of protection of macular pigment right there. And so, how do you get through? How do you get around this? Because folks who have a family history are already worried, and then if they also have this dip in the center of their macular pigment distribution, there's further risk there. So, yikes! What do we do? Well, you can get around that. You can actually bypass this conversion enzyme by supplementing directly with mesozeaxanthin. And you see, in 2012, a colleague of mine, John Nolan, showed that you can actually turn this dip into a peak in as soon as 8 to 12 weeks of supplementation with mesozeaxanthin. So you're able to actually regain that, genetically compromised situation by supplementing with mesozeaxanthin. So that's, each of the nutrients individually, mesozeaxanthin has the highest antioxidant capacity, followed by zeaxanthin and then lutein. They're all fantastic antioxidants. It just so happens that meso is the strongest. However, interestingly, the three together, in terms of defeating all different radical oxygen species, nitrogen, oxygen as well, oxidative species of all kind, the three together in that 1:1:1 ratio have the strongest protection compared to any individual, even mesozeaxanthin on its own. So the body knows best, and it's got the three in there in equal proportion. And if it doesn't, and you need help with mesozeaxanthin, you can supplement and build it up. So really cool.
Is zeaxanthin and mesozeaxanthin represented in the brain?
We have data on lower animals, chicken, for instance, and I believe rat as well, having mesozeaxanthin in the brain. We don't have direct evidence for mesozeaxanthin in the brain yet. Partly that's because we haven't really looked for it there. So, the jury's still out on mesozeaxanthin. Lutein, and to a lesser extent, zeaxanthin is definitely in the brain. Again, lutein's kind of the dominant one in the brain, as opposed to the retina, where you've got all three equally represented.
Cataracts. Lower your risk of cataracts with lutein, zeaxanthin, mesozeaxanthin.
Yeah, you actually find lutein and zeaxanthin. I know those two for sure in lens tissue, believe it or not. And so, as you might expect, one of the primary drivers of cataract is oxidation. And so we know, for instance, when you've got a vitrectomy in those patients, within a year, like 80% of them need cataract surgery because they've been exposed to oxygen. The oxygen gets in. The vitreous gel, by the way, has some of the lowest oxygen content of any tissue in the human body. And for good reason. I mean, it needs to manage oxygen coming from the retinal surface, which has really high, oxygen content, because if the oxygen reaches the lens, it's going to oxidize it and cause cataract. You're able to actually see relationships between macular pigment and incidence of cataract. It does reduce your risk of developing cataract.
I interviewed not long ago Deanna Minnick, who wrote The Rainbow Diet. And she's a proponent of having all different colors of foods, vegetables, and to get all different nutrients because every color has different nutrients. And I was wondering what you thought of that.
Yeah, I think Eat the Rainbow is a really generally a good guide. You've got this mix of not only the carotenoids that are yielding the colors, but you've also got different, polyphenols, bioflavonoids. These nutrients have various effects on, vascular tissues, neurovascular tissues. We've got, quite a short supply of this in our diet. We have, a lot of carbs and fats and sugars. And so we definitely could, do ourselves a lot of good eating the rainbow. There are, it's really special nutrients in all the colors. And you think about plant foods, fiber is incredibly important. And we've long known why, fiber, we've long known that fiber is associated with, health and longevity. Until fairly recently, we didn't know exactly why. Certainly fiber keeps things moving through the body. But what fiber does is it feeds, probiotics. It's a prebiotic. It helps stimulate the gut microbiome. So you've got those kinds of effects as well from plant foods, and the different fibers feed different populations of these gut microbiota, and so that's really the frontier, the new frontier for research, in my opinion. Certainly something we really are learning a lot about now, and all the benefits is this healthy gut microbiome, and that's another angle, maybe another podcast for another day.
Sure. And you mentioned one of the people that you measured had 1.5 log units. Do you remember what they were eating to get such a high, or what were they supplementing? What they did, or were they taking supplements 4 or 5 times a day, or were they juicing, or using a blender with different vegetables?
It's interesting, one of these people, they're rare. I've measured, I think, 4 total, but one of them's my dad, my father. And of course, he's interesting story. He was born very premature. This is 1948, and he was just 29 weeks of gestation. So he's very premature. Of course, back then, you barely surviving. Obviously, he made it. But yeah, so he started, a lot of the odds were against him for sure. But he, of course, has been following my work for a long time, consistently supplemented. My mom as well, who's very high, just not quite as high as him. It's a battle, it's a competition between those two. But yeah, so he's been supplementing consistently 25 years. And so he responds very favorably. And so he's got, this massive amount. Of course, his retinas look like, he's 30 years old. It's really cool. The others, every time it's consistent, lifelong accumulation. And so that's another important point, if I haven't made it so far, is that, these nutrients accumulate in the eye. They can change significantly within 3 or 4 months. We've seen this with supplementation studies. But generally speaking, this accumulation over time, once they're bound in the neural tissue, like the retina or the brain, they're quite stable. They will go down in the case of, excessive oxidative stress or inflammation. Systemic disease like diabetes is very pro-inflammatory. That will bring down these carotenoids. But once they're bound in the tissue, they tend to be able to quench free radicals physically. It's not a chemical reaction, so they don't necessarily go away. They can quench potentially millions of these singlet oxygen species, which is really cool. So the point is that if you start when you're 10 or 15, you've, maybe just live in a family that, emphasizes good nutrition, you're going to, build it up over time. And you will climb that mountain, and you will end up with prodigious amounts. Now, that was the case with these folks, and they were, rural individuals in Georgia, farmers that just ate, leafy greens every day. It's part of their diet every day. And one of them was at the Medical College of Georgia in Augusta, and the other two were when I was at the University of Georgia. So yeah, consistent ingestion over a long time period, and the capacity for these nutrients in the eye and probably in the brain as well is we know for sure in the retina, astonishingly high.
I'm a big fan of taking supplements, but I also juice and I also use a blender. What do you think about juicing or using a blender? And of the two, which do you think is better?
Juicing, I've got a warning for you on juicing. When you remove the fiber from the plants, from the fruits, vegetables, whatever you happen to be juicing, that tends to result in quicker passage through the GI tract. There's not enough time for you to actually absorb as many of these nutrients. So in the natural situation, eating, for instance, a piece of fruit or a vegetable, you chew it up. Some of the nutrients get liberated from the plant cell walls when you're chewing. Some get liberated in the stomach, but the fiber holds it in the gut for longer, allows for more absorption, so there's better bioavailability. So I'm always going to argue for, sticking the whole food into a blender, mixing it up, and then, and if you can include a little bit of fat in the mix, maybe it's, if you're doing a fruit smoothie, maybe it's a little bit of milk. You don't need to throw a stick of butter in there or anything, but just a little bit of fat that enhances the bioavailability of carotenoids for sure, and other lipid-soluble nutrients like vitamins A, D, E, K. So a little bit of fat, whole food, grind it up. You've still got some of the fiber in there. It holds it in the gut. You're going to get better benefit there. You could do worse than juicing. Obviously, you could go drink a Coca-Cola or something, but yeah, I think that, if, my advice would be to try to maintain some of the fiber in the mix.
And also with juicing, if you juice fruit, you can really raise your triglycerides. So you have to be very, very careful because like you said, there's no fiber. So it just goes right into the bloodstream and
Yeah.
it could raise the triglycerides. So let's get back to the studies with protecting the brain with the carotenoids. There's been some studies on mice.
Mhm.
Tell us about those studies and what you found with that.
So yeah, this provided the impetus for our current work here with the Penn State University in humans, in people. 2017, there was a study just using lutein, and again, this is a mouse model of TBI, so traumatic brain injury, and so you pre-treat these mice with pretty high amounts of lutein. I believe what amounts to about 50 milligrams a day. So that would be in terms of like bowls of spinach. You're looking at, for a person, that would be effectively 3 or 4 bowls of spinach. It's a lot, right? Nevertheless, they did this in the mice, and then elicited a TBI.
The mice get really strong like Popeye.
Yeah, right. Their forearms were huge, but yeah, that was a side effect, I guess.
Sorry about
Yeah, no, it's fine. And so then you induce a TBI, and in some cases these are a physical and sometimes like actual knocks on the head. Sometimes they're cold induced, so the freezing the brain quickly can produce effectively a TBI. In this case, it was a physical, knock on the head, and then you measure pro-inflammatory cytokines. You measure, brain-derived neurotrophic factor. This is key for neuroplasticity. You measure, proteins that are associated, like the tau, phosphorylated tau, but primarily these inflammatory cytokines that we discussed earlier. IL-6, IL-1 beta, tumor necrosis factor alpha, all of these things that go way up when you see TBI. And so in the control mice that didn't receive any of the lutein, their levels shot off the charts. In the animals that received the lutein, significantly less. And you also see significantly less edema, brain swelling, which is thought to lead to all of the headaches and sort of migraine symptoms that are typical of TBI. So that was 2017. In 2021, there's a study with lutein, zeaxanthin, and mesozeaxanthin. So all 3 of these macular carotenoids that we talked about before. Again, another mouse model, animal model, freezing model of TBI. And again, this is pretty significant. These are traumatic brain injuries that we're talking about here, not typical of your CTE, where you've got sort of jostling of the brain, or you bump your head, but it's not going to knock you out or anything. So just to draw the distinction there. In this second study, more of the same. You see less size of injury in the brain, the actual infarct, the damage, the lesion. You see less swelling. You see decreased pro-inflammatory cytokines across the board. You see increased, molecules that are associated with healing. So you see increases in, vascular cell adhesion molecule, brain-derived neurotrophic factor, again, thought to be protective in that it's helping to rewire some of the circuits in the brain. So very exciting to see this. And, I should note that when I was with the Air Force, this would be back around 2010, we tried to get, a program off the ground there. We very nearly secured funding for, a study in, military personnel who, of course, back then we're talking about, Iran and Afghanistan, a lot of improvised explosive devices, the IEDs, blast injuries that it resulted in concussion. So it was a big deal that it didn't end up happening. So I was disappointed, of course, at that point, but then excited to see these animal models come along. And again, this kind of provided the momentum, the motivation for, wanting to do a human trial, which we did just recently here in conjunction with Penn State University.
Before you talk about the Penn State trial, how long were the mice pre-treated? The one with the triple, the lutein, zeaxanthin, mesozeaxanthin, and the study with lutein. How long were they pre-treated before they were induced with the TBI?
It wasn't for very long. My recollection, I don't have the papers in front of me, but my recollection is that it was just for about 6 weeks pre-treat. So enough time to systemically get these nutrients up, certainly quite high in the blood, and presumably long enough for some to accumulate in the brain. And this is, it brings me to an important point. I'm glad you asked this because the idea here with protection against the severity and enhanced recovery for a TBI or even in a CTE repetitive impact situation, the idea is that you build up levels in the brain over time, just like with the macular pigment, where you're climbing that mountain, you're building it up over time. You build up, you get these targeted nutrients in place, and God forbid, you sustain a head injury or you go through this repetitive impact situation, but God forbid you sustain that kind of an injury, but you've got protection in place. So it's there. It's like having medicine right there, and something goes wrong, boom, it can be active and it can disarm this inflammation. So that's the idea all along. So it's not a reactive situation, although that may help as well. But you get a concussion and then throw carotenoids and fish oil at it. That could help. But my idea is,
has that been done yet, where someone or a mouse had the injury and then you threw a lot of carotenoids at them, or it's always been pre-treated?
Yeah, as far as I'm aware, it's the pre-treatment. And I haven't seen any work subsequent to that. So not yet. And I do know that some visual rehab docs, some ODs out there that work with sports folks, and they deal with concussion quite a bit. They're using and some are using carotenoids and omega-3s, but the forward-thinking doctors were putting a lot of fish oil into their patients, potentially 4 grams a day after a TBI, which is great. DHA, the omega-3 that gets deposited and accumulates in the brain, is fantastic at resolving inflammation in neural tissue. EPA, a little more systemic, but nevertheless, this is a good strategy. The most recent, work here with Penn State, we used a combination of the carotenoids and DHA, EPA in the supplement in rugby athletes, and so then of course we're not able to induce concussions. We don't want to do that in people. We're just going to let it happen naturally, and by let it happen, I mean we didn't hope anybody got a concussion, but just the playing of rugby is it's intense enough to produce several hits. They were experiencing, 30, 40 hits per game. And so it's a very physical sport, of course. And so there weren't any concussions reported through the season where we evaluated them, but there were a lot of these subconcussive hits associated with development of CTE.
Let me just set this up for 1 second. So they were pre-treated for 3.5 months with 10-10-2, lutein, mesozeaxanthin, and zeaxanthin, along with 250 milligrams of DHA and 50 milligrams of EPA. And they were pre-treated for 3.5 months. Do I have that correct?
Well, unfortunately not. So this is my idea. You've got the dosing right, and it was
Okay.
placebo controlled. So, some got it, some didn't. It was all blind. Nobody knew what was on what. But this is the tough part about running human trials. A lot of times you can't, and especially with athletes, like herding cats, they're just trying to gather them and control things. It's difficult. It's not like mice. So what happened in the study was that you got recruited into the study, and this was right before the season started, basically a couple of weeks before the season started. Recruited into the study, you got your bottle of either supplement or placebo, and then instructed to take one a day with a meal. Again, of course, the placebo's inert, nothing in there. And then you've got, lutein, zeaxanthin, mesozeaxanthin, DHA, EPA, like you said, all those amounts. Taking it for a week or two before the season started, and then boom, you start. And so this was kind of a mass recruitment from the intramural rugby team at Penn State. And, this was, women and men. And, if you wonder about intramural rugby, how serious it's taken very seriously. And these, folks play hard. And there, like I mentioned before, a lot of impacts. So, unfortunately, in a sense, there was not this pre-treatment. If I had my druthers, I would want, folks to be, on it for at least 3 or 4 months beforehand to allow some accumulation. Presumably you would see even stronger effects. That said, we did find, some really important effects for this study where you see, in certain parameters go up high significantly in the placebo group. It was sort of this neurofilament light chain protein associated with damage to neurons goes way up significantly. It actually decreased slightly in the supplement group, which was very encouraging. And then there was another protein, glial fibrillary acidic protein, again associated with axon damage in neurons, goes up nearly significantly in the placebo group, goes down in the treatment group, in the group receiving the nutrients. So despite the fact that we only had a very short period of time, 3.5 months study, and relatively few participants in the study, 31 total, you still are seeing these pretty significant changes. And again, anything that's helping even a little bit with this, you multiply that over time with repetitive head injuries, assuming somebody stays on these nutrients, you're getting, this reduction in cumulative damage that could really seriously help you protect against getting, chronic traumatic encephalopathy.
We're up against a break, but don't go anywhere. We'll be right back with Dr. Jim Stringham.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
Tell me about DHA and EPA. What's the difference? I know that most of the, probably almost 95+% of the omega-3s in the brain and in the eye are DHA more than EPA. But EPA is it more of anti-inflammatory? Because I notice when the companies are giving a dry eye formula, they'll pump up the EPA and decrease the DHA. And when they're doing something to protect the eye or the brain, they'll pump up the DHA and maybe decrease the EPA. But from your point of view, the roles of each one of them, if you could explain that.
Yeah, sure. I'm happy to. And there are a lot of misconceptions, and they come from some odd places. You see, like you say, for dry eye, EPA 3-to-1 ratio to DHA. From a nutrition science standpoint, where I'm sitting, both are exceptional anti-inflammatories, and believe it or not, they work together. So EPA resolves some sort of inflammatory situations better than DHA, and vice versa. But I wouldn't say one is better than the other. Definitely not. I mean, other than maybe location-wise, EPA tends to be more systemic. And by the way, these omega-3s, they're found in every cell in the human body. So you think about that. There's 40 trillion cells on average in the human body. Every cell. I mean, assuming you're eating some of these things, some oily fish or supplementing with fish oil, they've got EPA and DHA. So the body prioritizes these nutrients in a big way. EPA tends to be a little more systemic. It doesn't accumulate necessarily in tissues like DHA does in the retina and the brain. So resolving neural inflammation is typically handled a little bit more by DHA. And interestingly, with regard to DHA in the brain, it accumulates along with lutein in areas where lutein accumulates. So they go to the same area. And so the thought there is that lutein is protecting the fat, the DHA, from oxidizing. It's highly vulnerable to oxidation, these long chain omega-3 fatty acids. So they're very liquid. They have tons of really great properties in terms of neural communication for DHA. But any change in metabolic rate, heat, light exposure in the retina particularly, they can oxidize pretty readily. And so we think that, these carotenoids help protect against that oxidation. And oxidized, lipid peroxidation is not good for neural tissue. And it's thought to be one of the, major components of developing, neurodegenerative disease like Alzheimer's disease or macular degeneration. So a lot of information there, but where does this, idea that, 3-to-1 might be better for dry eye? Well, it probably came from early processing of fish oil, where the early distillation techniques primarily involved heat. That made DHA go away. It's more vulnerable to oxidation than EPA is. It made the DHA in the fish oil, the oil extracted from oily fish, go down compared to EPA. And what you were left with was about a 3-to-1 ratio of EPA to DHA. You test that for, a number of whatever conditions, maybe it's, heart health, in this case, dry eye, and no doubt it works fine. But when you look at the composition of oil in fish, you almost, without exception, see DHA higher in fish compared to EPA.
Like 3-to-2?
Yeah, roughly 3-to-2 DHA to EPA. And so, it's a bit of a head scratcher there. So listening to nature and the fact that, that's primarily where we get our EPA and DHA is through oily fish, salmon, herring, these kinds of things, sardines. And so, that's, I think, a big, artifact really of what appears to be artifact of manufacturing of fish oil. So, we have now studies that show DHA alone can help resolve dry eye, which I think both in a roughly equal ratio is the way to go. I mean, because that's what nature it tells us. When you consider all the precursors, walnuts, flaxseed, these kinds of things, along with, the actual molecular DHA and EPA from oily fish, roughly a 1-to-1 ratio, and that's going to get you benefits systemically and also in neural tissue. It's probably the best case scenario, again, based on what nature's telling us.
What age do you think parents or you as a parent did you supplement your kids with omega 3s? There's a lot of omega 3s that come in droppers, and you could use a dropper to get it into an infant. Obviously, they can't swallow a giant pill like they typically come with fish oil, but you could get liquid fish oil from some of the companies to help the eye develop, to help the brain develop. What do you think? At what age can you start immediately as an infant, or would you wait a little bit longer? Should it be when the mother's pregnant? Should you be eating
Yeah.
beans and the smash fish that have a lot of omega 3s? What's your opinion on that?
Yeah, I mean, you mentioned while you're pregnant. I mean, there's so much data to suggest that you pregnant moms, lactating moms, so start early. Again, this isn't feeding the child directly into their mouth, but it's feeding the child through the mom, and of course, mom gets major benefits as well from this. But in terms of retinal development, brain development, and you just need to know what the nutrient is and where it goes. What does it do and where does it go? And so we know with, for instance, DHA, we know it's a major anti-inflammatory. It probably helps guide neural tract development and also helps with neural communication. So more of it's most likely going to be better. We assume the body's going to regulate the amount that it needs. And so it's another issue. People think, well, they treat nutrients kind of like drugs, where, too much is you're going to have an overdose or something like that. Well, typically with nutrients like this, the body is able to regulate levels in different areas. And, you can go overboard and have too much. But in most cases, you either have vast stores on the body for these nutrients, or the body can excrete them. And it tends to be true with regard to the omega 3s within reason. Dosing up to 4 grams a day is totally fine, totally safe. And that's quite a bit. We know the dry eye dose is about 2 grams a day. For children, this is a concern because typically, again, with drugs, we're dosing, milligrams per kilogram of body weight. I would, and I haven't seen no real contraindication with regard to amount. And I think that, with regard to development, there's potential for oxidative stress and inflammation that can impact the development. There's also oxidative stress that is a result of development. So nutrients like carotenoids, they can resolve oxidation, resolving inflammation with the omega 3s. With my kids, my own daughters, we would have high quality fish oil and simply take a safety pin. I mean, if you're careful, you just poke into the pill, squirt it into a smoothie. And they would get roughly a half a gram a day, which was effectively one pill. I think 550 milligrams a day, equal ratio EPA DHA. Now they're old enough, my kids are 18 and up to 21. And so, they take 2 a day, which is a little over a gram of fish oil, and they also take a carotenoid supplement. We emphasize eating healthy as well, and so they do, but they're teenagers for the most part, and so there's a lot of pizza involved, and so helping the supplements definitely help that situation. But early. I don't think it's really ever too early, and I don't think you can hurt your child with these nutrients. Never actually heard of a case where a child has had problems with taking 20 milligrams of macular carotenoids or say a half a gram of fish oil. It's just a matter of getting it to them. Obviously, like you said, the pills can be quite large, and maybe age 8 or 9 or 10, they feel okay to swallow a pill, at which case they can switch over. But before then, maybe squirt it into a smoothie.
One of the problems with some of the supplements, and I've noticed lately, is that there are counterfeit supplements out there. How do we make sure that our patients are getting something that's not counterfeit?
Well, I mean, glad you asked this, Gary. We went through something with MacuHealth, and so typically we sell only through optometrists, and of course we're third party tested, vetted up one side and down the other, and so when we go direct to you from our warehouse here in Phoenix, there's no concern at all. Where you run into problems is when you look at places like Amazon. And so we do have a presence on Amazon. Of course, there are copycats out there, and while in some ways it's flattering that, some people would want to copy us, it's not good at all because, you find a label that looks like MacuHealth, you see, oh, wow, it's a lot cheaper, I'm going to buy that. And, instead of, X amount, it's half or less. And so, I understand being a consumer, you think it's the same thing, it's cheaper. Well, turns out that these pills are filled with nothing. They may be filled with sand or something. You don't know. One that we got from Amazon appeared to be filled with mayonnaise. So, which, whatever, I don't know your feelings on mayonnaise, but it's not macular carotenoids. And so it's concerning. So now we've taken measures specific to Amazon. Walmart is very similar, where we're able to shut those guys down. We have special protective mechanisms in place that when you get MacuHealth from Amazon, it is MacuHealth, and so that is security measures on the front end by us. So they scan codes when they take in their inventory, and so it's been a battle to keep it out in front of that, and really a battle in general in the supplement industry. I spent the majority of my career in academia, and so when I came to industry, working with MacuHealth, I bring the science with me, but then there are challenges in industry, and just because the supplement says it's got, say lutein or zeaxanthin on the label does not necessarily mean that supplement has lutein and zeaxanthin in it. So what we do, just as quality control, is we have, a third-party company, Supplement Certified, actually measure each batch that we produce, the content that's on the label, and that's true of all of our products. It's expensive to do that, but we ensure that we're meeting label claim. They keep that batch, they keep it throughout the shelf life, and we've shown stability. The shelf life's 3 years, but we've shown stability out to 7 or 8 years for our products. So it's pharmaceutical grade processing. Very few, if any, companies that I'm aware of, nutritional supplement companies, do this. Again, we want to make sure that if you're taking the product, it's what it says it is on the label. It's stable throughout the shelf life. And as a scientist, I want people to experience the benefits that we show in the scientific studies. And of course, in the scientific studies, we know exactly what's in the supplement. And so we're able to, map what you take onto the effect. And then we want patients to experience those benefits as well.
There's been some new new ways to get better absorption of the carotenoids. How do you do that to get better absorption so it gets into the serum a little bit better, other than, some people can't absorb because, as you talked before about the microbiome, and some people, their microbiome is not good and they can't absorb well. How do we absorb better? And how do supplement companies, what can they do to make the supplement absorb better?
This is a great question, and yeah, it's not going to have any effect if you can't actually get it through the intestinal wall into the blood, right? So that's kind of encompasses what bioavailability is, and most folks have heard that term. It basically speaks to the percentage of a nutrient that is ingested, how much of it gets into the blood serum, and so with regard to carotenoids, for instance, they are lipid soluble. So they go into lipids, and that's the first step when they're in the gut. And so they go into lipids, and then they're able to be incorporated into these special micelles, and they're able to get drawn across through the intestinal wall into the bloodstream. That's ideal, that situation. So lipids help. So if you're taking, a macular carotenoid supplement, for instance, taking it with a meal that has at least a little bit of fat in it. Again, it does not have to be, a stick of butter, but just, some fat. That will enhance bioavailability significantly. Another way is a technology called micromicelle, and so we've developed this roughly 5 years ago, and what that does is so when you take carotenoids, lutein for instance, and you extract it like from a marigold flower, which is often the way it's done. You purify it, put it into some oil in a supplement pill. That's ideal. Some companies powder it, which is not ideal. It oxidizes and you virtually have no carotenoids after a few weeks. But anyway, you put it into some oil, ideally in a supplement. The lutein itself will tend to crystallize. And so that's not the end of the world, but that reduces the bioavailability, reduces its ability to get across, incorporated into the intestinal, the enterocytes and across into the bloodstream. So we want to try to prevent that crystallization. And that's what this diacetate micromicelle technique does. It actually forms a kind of a very small micelle, a little glob that protects the carotenoid molecules, and it allows it to not crystallize. It prevents it from crystallizing. And so what that does is it makes it a much smoother transition from the inside to the outside wall of the intestine and into the blood. So it's pretty fascinating. On the face of it, it's not a super complex idea or method, but wow, it enhances bioavailability by something like 15 or 20%, which is a big deal considering that already in terms of MacuHealth, we were getting, somewhere around 70-75% bioavailability, which was almost as good as food. And like actual spinach, and so if you're enhancing further beyond that, that's wonderful. So we do have exceptional bioavailability. We still recommend eating, you're taking your supplement with a meal, but still, I mean, it's great to know that you're getting a very high percentage, probably close to 90% of the content of the supplement.
How about if you're taking a medication like a PPI? A proton pump inhibitor, which decreases the acid in your stomach and lowers absorption of food. How does that affect something like MacuHealth that has micromicelle? Will it lower that absorption as well?
I think it may have. We don't have any formal studies on that. It may have effects, albeit I think they're probably minor. And I say that because the acidity of the stomach does not have to be dramatic to break down in this case, like the capsule that contains the carotenoids, or in the case of fish oil, DHA, EPA. So you don't need a ton of acid. And then, ultimately down the line, PPIs may inhibit slightly the absorption, but it's primarily a function of the breaking down of the food. So when you think about, eating, spinach, for instance, you break down some of the food by chewing it, and there are salivary enzymes that help with that. A lot of it, breaking apart plant cell walls happens in the stomach, the gastric acid, and then it transfers, of course, into the intestinal system, the GI, and you get absorption of some of those nutrients that have been liberated from plant cell walls. In the case of a supplement, you're not dealing with fiber; you're dealing with the shell, the capsule. And so, if you're able to break that down, then you've got full liberation of the nutrients within that capsule. So hopefully that makes sense. It wouldn't, in my mind, compromise, bioavailability, although I must qualify and say haven't studied this directly yet. But on the face of it, it looks like it's, wouldn't be much of a factor.
As we finish up, you're an expert and you've done the studies on sports, on baseball, and carotenoids. Talk to me about the studies and how carotenoids can help you in baseball. I mentioned at the beginning of the podcast how it's really helped my son hitting a baseball. He rarely swings and misses, rarely strikes out. And some of the kids who did swing and miss a lot, when they started using the 10-10-2 formula, 10 meso, 10 lutein, 2 zeaxanthin, they built up their macular pigment and they stopped swinging and missing as much. So tell me about the studies that you did and how did you realize that this was gonna work?
Yeah, so I mean, initially, the studies we looked at, glare is an issue. So I'm playing baseball. A lot of times you're playing outside. You're in Florida. It's a very sunny place, and so even just ambient lighting like that it can reduce contrast. And so we kind of fail to appreciate how important contrast sensitivity is, and even in a baseball situation, just localizing the pitch, picking it up right out of the pitcher's hand in a batting situation, that's going to be greatly enhanced by even a small change in contrast sensitivity, especially if there's, back lighting, whether from stadium lighting or perhaps the sun, that glare can really take down contrast. And so that's step one. We saw this improvement in contrast sensitivity with folks who had higher macular pigment. And this was, studies earlier on with the military that I did. Couple that with speed of visual processing. And you can test this a couple of different ways. You can test, at the timing of a prediction of timing of a streaking light. When is it going to intersect a certain point? And you push a button when that's going to happen. Well, we have data on that. Higher macular pigment, much more accurate tracking of various speeds of light. When is it going to hit? And you can imagine how that applies to baseball, where you're trying to meet the ball with the bat and the timing of things. So that's one way to look at speed of processing. Another way, a very raw method, is to test flicker fusion. So critical flicker fusion frequency. That's a mouthful, but it's basically a flickering light that you physically speed up the flicker rate until a point when it appears fused. It's not flickering anymore. Even though it is physically still flickering, perceptually it looks like it's not. Those with high macular pigment, as a function of the level of macular pigment, will actually have higher fusion frequencies. So somebody like perhaps your son will have a fusion frequency of, say, 30 cycles per second, 30 flashes per second. He can still see it flickering, whereas somebody with lower macular pigment would see that light and say, it's not blinking at all. It's totally solid. It's a solid light. They'd be convinced, and I've seen this in the lab. You have a flickering light and people look at it and say, it's definitely not flickering. And then another guy says, oh, that's definitely flickering. That's just because that second guy's, flicker frequency, that fusion frequency is much higher. And so, at some point, everybody has that fusion, but for some, that is much higher. And so what that speaks to is the speed of your visual system. If you, at very high, frequencies, can still see the flicker, that means your visual system's very fast. In baseball, what that translates to is, sort of, you can think of it as more frames per second. Your visual system's processing a lot more information. And when you're talking about baseball, you've got 60 feet 6 inches from the mound to the plate. A fastball's coming in, and depending on your skill level or whatever, in the major leagues, we're talking about 95 miles an hour. You've got under 0.4 of a second, to respond and decide whether to swing or not to swing. Speed is of the essence. I mean, it's incredibly important. I don't have to tell you, and your son knows this as well. So if you're able to process, you're able to see what's going on, pick up the ball first, and then potentially see the spin of the ball. That's another thing. We looked at the Xavier University baseball team a few years ago, 2019. This is up in just north of in Cincinnati, Ohio, and 20 position players measured their macular pigment, CFF, the critical flicker fusion, contrast sensitivity, and found some really interesting connections where higher macular pigment, better contrast sensitivity, faster visual speed of processing. And you ask the two guys on the team with higher than 0.7 macular pigment density, those are the two guys that claim to be able to see the rotation of the baseball, the seams of the baseball, when it was pitched. And if you can get that information, certainly at a high level, like in college baseball, that is huge. So you're able to see the ball not only come out of the pitcher's hand, but also the spin of the ball, which will tell you in many cases what pitch it is. And so, I mean, all of this is happening very quickly, but just that little bit of an advantage is huge. Ask any baseball player, if they can see the rotation of the pitch, they know that's a major advantage. And the other players on that Xavier baseball team, they're like, no way, you can't see the spin of the ball. It's impossible. Those two guys that could do it had the highest macular pigment. So it's pretty neat, these connections that you see. And so, yeah, that's in a nutshell where, these nutrients, this macular pigment can really help performance.
Are major league players taking these macular supplements?
Yeah, we do have teams that are taking, Vision Edge Pro, which is one of our products that has, the carotenoids and the omegas. That's the same formulation that we used in the Penn State Impact Athlete study, by the way. So anyway, but yeah, we do have some teams. I don't know if I'm able to actually say who exactly, but there are major league teams that are taking it, and team doctors that are advocating for this. Some of them I know personally, and have been counseling them, talking to them about this, and they've seen benefits not only in clinic when they examine them, but also performance benefits on the field.
Well, Jim, you've given us a master class in macular pigment, brain, eye. Is there anything I left out that you'd like to talk about?
Gosh, I mean, there's a lot out there, and throughout the 25, 30 years I've been doing this, it's a lot. I think looking to the future is always important. What's next? I think the microbiome is a huge, deal here. I think in probably 15 or 20 years, we'll talk about everything gut first, and then where how that results in neural health, skin health, pancreas. All of it's connected to the gut, of course, and these nutrients we've been talking about have positive impacts on the gut microbiome. The carotenoids, the omegas, and so hopefully I know we'll be doing some studies on that. We've got some planned, so stay tuned for that. And then I think, you mentioned in my bio, I'm very interested in developing, kids and how these nutrients can help them. Certainly, I think that's been lost. We started at the back end of things with macular degeneration, disease of aging. But let's look at the front end here, and we can really help those individuals. And then lastly, the CTE story. I think there are over 1 million high school football players in the United States. Over 1 million, and we stand to help a lot of these people, and it's not just athletes, but everybody. If you're involved in a car accident and sustain a TBI, these things can help you too. But I think that most poignantly we see the outcome of these impact sports on development of CTE and how that can damage lives and families. And so, if we can help these individuals, that'd be wonderful. So I think, we're moving forward with that. Hopefully we can get some buy-in from big organizations like, the NCAA and NFL. We're working on that right now. So I'll keep you updated.
And if people want to get in touch with you, or from listening to this podcast, they want to help you with your research, how could they do that?
It always feel free to email me. It's jstringham at macuhealth.com. I'm developing a website now, a personal website called drjimstringham.com. And so that's something. It's Dr. Jim, Jim Stringham at I think that's at .com is it, and so if you want to check that out, it's live, but it currently a little bit under development, but it's getting there, and so and feel free to reach out to me through there as well. But I'm happy, and I hope to engage with a few of you. That'd be great.
Dr. Stringham, I want to thank you for joining me today. You're certainly a wealth of knowledge. You gave us a masterclass today, and I really appreciate your time. I want to say thank you again.
Thanks, Kerry. It's a pleasure. I appreciate you having me on.
Thank you.
MacuHealth is a nutritional supplement leader. Our targeted formulas include MacuHealth for daily eye health, MacuHealth Plus for aging eye support, Vitreous Health for vitreous care, Vision Edge Pro for visual performance in athletes, TG Omega-3 for ocular and systemic wellness, and MacuHealth DM for eye and metabolic support. Call MacuHealth today and mention this podcast for special discounts. Experience the difference with MacuHealth. Nutrition you can see.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode.